In this presentation, we'll explore the different types of diuretics, their mechanisms, clinical uses, and side effects. Whether you're a healthcare professional, a student, or simply interested in pharmacology, this presentation will provide you with a detailed understanding of diuretics and their role in medicine. Diuretics are a class of medications that promote diuresis, the increased production of urine. They are commonly used to treat conditions like hypertension, heart failure, and certain kidney disorders. By expelling water and sodium from the body, diuretics help to reduce blood volume and pressure. Today, we'll delve into the various classes of diuretics, each with unique mechanisms and applications. First, let's discuss loop diuretics. The prototype drug in this category is furosemide, commonly known as Lasix. These diuretics act on the ascending limb of the loop of Henle in the kidneys. They inhibit the sodium-potassium chloride cotransporter, leading to a significant increase in urine production. This makes them particularly effective in rapidly reducing fluid overload. Loop diuretics are used in managing edema associated with heart failure, liver cirrhosis, and renal disease. They are also effective in acute pulmonary edema. However, they have side effects like hypokalemia, dehydration, and ototoxicity, especially when used in high doses. Careful monitoring is essential when prescribing these medications. Next are the thiazide diuretics. Hydrochlorothiazide is a well-known example. Thiazides act on the distal convoluted tubule and inhibit the sodium chloride transporter. This leads to a moderate increase in urine output. They are less potent than loop diuretics, but are commonly used for their blood pressure-lowering effects. Thiazides are primarily used in the treatment of hypertension. They can also be used to prevent the formation of certain types of kidney stones. Side effects include hypokalemia, hypercalcemia, and in some cases, increased cholesterol and glucose levels. Patient education on these side effects is vital. Moving on to potassium-sparing diuretics. Spironolactone is a key drug in this category. These diuretics act on the distal parts of the renal tubule and help the body retain potassium while excreting sodium and water. They are less potent as diuretics, but are useful in balancing potassium levels. Potassium-sparing diuretics are used in conjunction with other diuretics to prevent hypokalemia. They are also used in the management of heart failure and ascites due to liver cirrhosis. Side effects can include hyperkalemia, gynecomastia, and menstrual irregularities. Monitoring potassium levels is crucial when using these drugs. Now let's talk about osmotic diuretics, with mannitol being the prototype. These diuretics work by increasing the osmolarity of the blood and renal filtrate, leading to increased urine flow. They are different from other diuretics as they do not act on specific transport mechanisms in the renal tubules. Mannitol is primarily used to reduce intracranial pressure in patients with brain edema. It is also used in cases of acute renal failure to maintain urine flow. Possible side effects include dehydration and electrolyte imbalances, particularly hyponatremia. Lastly, we have carbonic anhydrase inhibitors, with acetazolamide as the prototype. These diuretics inhibit the enzyme carbonic anhydrase, reducing the reabsorption of bicarbonate in the kidneys, thereby increasing urine output. Acetazolamide is used in the treatment of glaucoma, altitude sickness, and certain types of epilepsy. Side effects can include metabolic acidosis. And that concludes our video on diuretics. Don't forget to like, share, and subscribe for more videos.